about shoulder pain in golf. It's one of the more common issues that we see. I actually just had a guy earlier today who I saw for the same exact problem. And I actually drew him the same exact picture that I'm going to go over with you guys today. So one of the most common issues that we see with shoulders is going to be raising your arm up overhead. A lot of people will raise their arm up and they'll say they'll get a pinching or pain or tightness kind of up in this upper area. That's usually indicative of what's called impingement, which is one of the big things I'm going to talk about here today. If it's on your trail shoulder, so as a golfer, as a right-handed golfer coming back into your right side, you can a lot of the times get away with playing even with an impingement because your shoulder never really comes above shoulder height. You will be limited though in how much you can rotate that arm back, which will negatively impact your ability to get back on the plane as you come down through impact. So when we're talking about impingement, the one thing that I really want to make sure that you understand is what it is and how it can be fixed. So picture one up here is a shoulder at rest. So if I turned, this would be the back of my right shoulder with my arm out to the side. Okay? This is my shoulder blade. My spine would kind of be coming down right to the inside of that. So what normally happens that will cause impingement is the muscles on top called the upper traps, these guys up here, these will oftentimes pull in towards the spine. Then we'll use they will pull up, towards the ears. Your rhomboids in here will actually pull towards the spine. If you've ever been to a therapist or a medical professional told you to pinch your shoulders back and down, that advice might actually be a little bit incorrect. That's what they're coaching you to do. And when that happens and your upper trap is pulling up, then your lower trap will tend to pull down. So as you go to try to raise your arm up, your upper trap is pulling up, your rhomboids are pulling in, and your lat is actually pulling down, which it's connected to your arm. So if it's pulling down, it's going to pull your arm down. So it's actually fighting you getting your arm up overhead. So when you go to raise your arm, you'll kind of look like this. Upper trap is pulling up, shoulder blades back, and you're fighting your lat to get to here. Ow, my shoulder hurts, it's tight up and through this area. What should be happening is what I drew the first time. Your upper trap should be pulling towards your spine. Your lower traps should be pulling down, and your what's called your serratus anterior, or if you ever saw or have seen a boxer punch, you'll see the serratus muscle kind of coming around like fingers underneath on their ribs. That's what's supposed to happen, and when that happens, that shoulder blade's able to rotate to this position up overhead, where I'm not shrugging, I actually have space between my ear and my arm. And as you can see, there's nice space throughout what's called the glenohumeral joint. So when you're at rest, this is your bone of your scapulus coming through here. There's the head of your arm or your humerus. If this was to come up without the shoulder blade moving, you can see where that would end up kind of pinching at the top there. And that's where you get that tightness or that discomfort at the top of your shoulder. So most shoulder pain in golf actually comes from just poor, what we would call scapular humeral rhythm, or basically the way in which that shoulder blade moves around as your arm goes up. So what we're gonna do in the next segment is we'll actually go over, show you in the golf swing where this would become a problem for you. And we'll actually show you some ways that you can get around it if this is currently going on until we actually show you how to fix it, which will be the final segment of the video today. So we're going to take you through how it's going to impact your golf swing, how to fix it, and then we'll finish up with a little bit of take to the course advice. So if you do have shoulder impingement, there's a couple of ways that it will impact your golf swing. The first being getting it up to the top of your backswing. As you start to take it back, you're probably going to get stuck about here. At that point, you have a couple options. You either kind of chicken wing and bend the elbow and bring it up to this point, or you're going to kind of stand up to continue to rotate around. Those are usually the two ways that we'll see somebody with a shoulder issue compensate. Now, if your impingement isn't terrible and you can actually get up to that point, you may just shorten your swing a little bit and you may be okay and be able to play without much issue. Now, as you come through the golf ball, now this is assuming obviously that you have a impingement issue on the trail shoulder. As you come through the golf ball, you're going to be much more prone to coming over the top, because coming in on plane and flattening it out in terms of externally rotating that arm is going to be more challenging for you. So you will be more prone to come over the top or swing left, which if you can manipulate the club face, you might be okay. But those are two ways that the trail shoulder having issues and having pain are going to really impact your ability to get through the golf ball. The third will be actually as you come down through impact. You sometimes, depending how painful the shoulder is or is not, you may be more prone to flip and chicken wing the opposite shoulder, which can lead to forearm and elbow issues. Now, if it's your lead shoulder that's the issue, generally a lot of times you'll be okay taking it back, getting up into the top of your swing, and then as you come through, more of your issues will be at impact, whether the jarring of the vibration aggravates your shoulder, or if you chicken wing or flip through, following through may be of issue to you as you come through there. So lead shoulder and trail shoulder can be affected either way. There are some of you out there, and I've had a number of people like this that I've worked with, they'd have their arm only goes to here and it hurts, but they can play golf just fine. So from a golf swing standpoint, if you take it away, kind of, if you're taking away crazy inside, you're still going to come up over the top, but you may be okay because your arm's not coming anywhere up there. But as you take it away, you may flatten it out a little bit more. There's manipulations that you can make from a technical standpoint to protect that shoulder so that it kind of goes unnoticed. Now, if you don't address it, it will progress into points where you can't actually swing the golf club effectively. So that's where we're going to go into our next segment. We'll show you actually how to fix these issues before they become bigger problems and really start wreaking havoc in your golf game and more importantly in your life from day to day. So I have Megan here with me today. She's having some shoulder pain, some impingement issues. So what we're going to do is we're going to take her through 3 simple exercises that are the most commonly effective in terms of freeing up the muscles around the shoulder blade so that it can actually move like it's supposed to. The next step after we free those muscles up is then actually going into exercise-based programming to get the serratus anterior to actually work to drive that up, the low trap to help to create some downward pull so that that shoulder blade really rotates the way it's supposed to and your arm can get up overhead without impingement. So the first exercise we're going to do is for the subscap. So what we're going to have Megan do is kind of hunch over a little bit with her arm hanging. She's going to come up underneath on the side of kind of the back part of her arm so as you can feel, if you guys can see here, this is my lat that I'm pinching. I'm going to take my thumb up on the inside there and she's going to try to kind of dig up into the, pushing into her shoulder blade to find the sore spot. And then once she gets that, she can kind of just let her arm run around, kind of just little circles. She can actually lift her arm up and down. The key here is really driving with that thumb up into that sore spot. Can you feel it working pretty good there? Okay. For most of you, that will be a pretty uncomfortable place to get at. Having discomfort in there is okay. It's what we're trying to get rid of. So if it hurts, we want to really kind of try to break that up and go after it. Myofascial work is one of the few exercise categories where some discomfort and pain is okay as long as it's what we're looking for. So after you've done the subscap, that should start to free up your ability to go overhead a little bit. Then we're going to get into the pec, which is another muscle that when it's tight will restrict you going up overhead. So why don't you go ahead and stand up. What we're going to do is actually we'll have you use the lacrosse ball. So the pec comes kind of underneath the clavicle or the collarbone. It comes down all the way, kind of, you guys, if you can pinch your pec or your pec minor out on the side here, comes down just below the nipple, around over to the sternum, and then up. So it's a pretty big muscle for most people. You can put your whole hand, you probably still don't cover the whole thing. And particularly for women who do have breast tissue, you actually will not be able to go all the way down. So you will be limited a little bit to staying to that top half of the pec. But you should be able to get over to the sternum, along the clavicle, and then over into that pec minor, which honestly for most people is the worst one. That tends to pull us forward this way. So we're going to use a corner of a wall here. So we're going to have Megan here put the ball on her pec. So if we got her if we turn to here, so you guys can see kind of collarbone here and pec minor here. So we'll start with that ball kind of right over in the corner there. And she's going to go ahead and lean into the wall. So she's got the, the ball in that area. And then she's going to roll kind of left and right, nice and slow. She'll explore up and down a little bit until she finds a spot that's uncomfortable. So let us know when you find one.
Right there.
didn't take long. And then once she's found one, then we can take her right arm, so she's pinned here, and try moving it up and down the wall as best she can to try to strip that restriction out from underneath that get the tissue moving out from underneath that restriction to restore that fascia and muscle sliding and gliding on each other. Can you get all the way up on the wall, all the way up? There you go. Good. So if you guys find a corner, usually a door, like the corner of a door works well. Somewhere that isn't up in a corner like we are here will work a little bit better, give you a little bit more range. Particularly if your shoulder's tight, you may need to go out wide in order to get that arm up. So then she would come all the way, do the same process across around the entire pec. So that's for subscap and pec. The last area that we're going to look at is going to be the infraspinatus, or the back part of the shoulder blade. So I'll trade you here. Let's have you turn backwards again. So if you guys can see her shoulder blade, I'm kind of pinching the bottom corner, and it's up here. So it's kind of a triangle. So she's going to take this ball kind of right into that lower part of the triangle, and then she's going to start to work up into this area up through the back of the shoulder. That's going to be the main area of focus. She is going to go over in between the spine. So this would be her spine through here. So we've got spine, shoulder blade starts. There's a little area in here between the shoulder blade and the spine that you do have some rhomboids, middle traps, some other retractor muscles that do get pretty and get in trouble too. So why don't we go ahead and get that up on the wall. Okay, and she's gonna take her arm across her chest. And that's gonna really pull that shoulder blade around to open up the space between the spine and the shoulder blade. And she's gonna just kind of, again, explore up and down. We call it search and destroy. You're searching for those spots that really are uncomfortable and trying to get rid of them. Let me know when you find one.
Right there.
Pretty quick, okay. So you're gonna bring your arm back and forth again. So again, we're pinning that restriction just like we did with the pec and the subscap. She can go up and down as well. Good, and if this makes your face turn a little red, that's okay. These spots are usually pretty uncomfortable. Good, so she's kind of in the middle between the spine and the shoulder blade there. So then if we pull our arm back across, and let's rotate a little bit this way. So you'll have to, in order to, once your arm's pulled across, your shoulder blade's gonna pull around. So you'll actually have to turn a little bit through there in order to find it, okay? So those are the two areas that you really want to address through the infraspinatus and along through those retractors. Hopefully this is helpful to really address these three major areas. If you have any questions with this, as always, check out our other specific videos to these, or by all means shoot us a note and we'd be happy to help you out finding these. So hopefully you got a lot today from going over how the shoulder pain happens, how it can present in your golf swing, and ways that you can get around it, as well as, most importantly, how to fix it. If you have any other questions about shoulder pain, please don't hesitate to email us at the address that's on the screen right now, info@parforsuccess.com. And as always, if you have questions, feel free to give us a call at the office. We're more than happy to chat with you about what's going on. Now, while we talked about shoulder impingement today, that is not the catch-all for all shoulder pain, and this is by no means meant to be a medical diagnosis or a replacement for seeking out professional care near you. But we are more than happy if you do have questions. If this doesn't help within a week or so, do give us a call. We'll be happy to direct you to the right professional near you. Or if you are local and we can help you, we'll be happy to do that too. So if you have any questions, please let us know. Remember this is going to be hugely important for you, particularly as you guys get older. This tends to pop up a little bit more. And always remember to swing faster, play better, and hurt less.